The scapula is a flat, irregular bone. It is triangular in its outline and it has four processes. To determine the side and the anatomical position, you have to look for this border, which is the longest and thinnest, is the medial border, and this shelf-like structure is named as the spine of the scapula, and the spine comes posteriorly, and this surface is named as the subscapular surface, which is concave, is anteriorly, and this glenoid cavity is facing laterally. So now this is the medial, this is lateral, superior and inferior. So this is left scapula. The features of the scapula, longest and thinnest of all the three borders is the medial border. The superior border is short, and to the lateral end of the superior border there is a notch named as the suprascapular notch. The lateral border is the thickest of all the borders. It has a superior angle, a lateral angle, and an inferior angle. At the lateral angle, you will find the glenoid cavity. There are four processes for the scapula. Posterior shelf-like triangular process named as the spine of the scapula. The spine is attached to the posterior surface of the scapula, dividing the posterior surface into a supraspinous fossa and an infraspinous fossa. This is the glenoid cavity. Between the glenoid cavity and the spine of the scapula, there is a notch named as the spinoglenoid notch. From the upper part of the glenoid process, there arises a beak-like process named as the coracoid process. The coracoid process is facing forwards. From the tip of the spinous process, there is another flat process named as the acromion process. The acromion process has a facet which articulates with the clavicle to form the acromioclavicular joint. When you look at the glenoid cavity, so in this orientation, this is anterior, this is posterior, superior, and inferior. You are looking from the lateral aspect. The glenoid cavity is pear-shaped, and in the upper part of the glenoid cavity, there is a tubercle named as the supraglenoid tubercle, and about 1 to 1.5 centimeter below the glenoid cavity, on the lateral margin, there is infraglenoid tubercle. Anterior surface is concave in appearance, and this is named as the subscapular fossa. The main muscles attached to the parts of the scapula from the supraspinous fossa arises the supraspinatus, which runs laterally. From the infraspinous fossa arises the infraspinatus muscle that also runs laterally. From this part between the superior angle and the root of the spine, the levator scapulae, and from this small region close to the suprascapular notch, inferior belly of the omohyoid, to this part is the insertion of the rhomboides minor, and to this entire medial border below the root of the spine gives the insertion of the rhomboides major. To this part on the posterior surface is the teres minor, and from this part gives the origin of the teres major. This infraglenoid tubercle and the supraglenoid tubercle gives attachment to the long tendons of two muscles. The supraglenoid tubercle gives origin to the long tendon of the biceps brachii. Infraglenoid tubercle gives origin to the long head of the triceps brachii. Close to the medial border onto the anterior surface, there is the insertion of the serratus anterior muscle, which helps for the punching movement. From this, subscapular fossa gives origin of the subscapularis muscle, which arises from here and runs laterally. These four muscles, supraspinatus, infraspinatus, teres minor, and subscapularis, together is named as the rotator cuff muscle This has a very significant role in maintaining the integrity of shoulder joint as well as movement of the shoulder joint. Attachment to the processes are to the upper lip of the crest of the spine of the scapula, the insertion of trapezius, which is extended to the medial border of the acromion process. To the lower border of the crest of the spine of the scapula and continuing to the lateral border of the acromion is the origin of the posterior fibers of deltoid muscle, and here is the lateral fibers of the deltoid muscle. The tip of the coracoid process gives origin to two muscles, short head of biceps and coracobrachialis. The medial border of the coracoid process gives insertion to the pectoralis minor. This part gives attachment to the coracoacromial ligament. The tip of the coracoid process gives attachment to a ligament named as the coracoacromial ligament, stretching like this. The suprascapular notch is bridged by a suprascapular ligament, converting this notch into a foramen. The suprascapular nerve is passing through the foramen, and above the ligament passes the suprascapular artery.